everyone, a warm welcome to all the respected doctors joining us today. I am Ankita Sharma from the product marketing team, and on behalf of the entire Dermaglow division of Hetero Healthcare, I would like to thank you all for taking your valuable time to be a part of today's session on topic low dose oral minoxidil. It is my pleasure to welcome Dr. Farzana, a distinguished dermatologist from Trivandrum with 7 years of experience in clinical and aesthetic dermatology. With a special interest in hair disorders and anti aging procedures, Dr. Farzana has been actively involved in the management of various dermatological conditions and integration of evidence based therapies into clinical practice. In today's webinar, Dr. Farzana will share her expertise on topic low dose oral minoxidil through clinical applications, efficacy, safety, consideration, patient selection, practical insight for optimizing the treatment outcomes. We are delighted to have you, ma'am, and looking forward for an insightful and an engaging session. So, without taking much time, I would request ma'am to please take over the session.
Good evening. Thank you for the warm introduction. So, without any delay, we can start the session. So, today I'll be talking about low dose minoxidil in trichology. Next slide, please. Yeah. Why oral minoxidil? Because it is very easy to administer a pill than applying a messy forms. This is actually a myth. Some people that doesn't much not much interested in taking oral minoxidil. For them, we can apply, we can give topical minoxidil. But for the convenience, we can say oral minoxidil is far better compared to the topical one. Next slide, please. Yeah, so now we'll figure out the mechanism of action of the oral minoxidil. As we all know, it has a multi-faceted action. So main action is a vasodilator. It stimulates the ATP-sensitive potassium channel. That is why it is being given for as an antihypertensive drug because of the potassium channel opening activity. Second thing, it is a beta-catenin signaling pathway inducer. So it stimulates the vascular endothelial growth factors and related beta-catenin signaling pathway. Third one is an anti-inflammatory agent. It reduces the perifollicular microinflammation by inhibiting the various inflammatory mediators such as interleukin 1b and prostacyclin. The fourth one is an anti-androgen effect. It reduces the expression of 5-beta reductase type 2 gene in human keratinocyte cell. Last one is the enhancing the synthesis of DNA in the anagen bulb. Next slide, please. Yeah. So, as a pharmacokinetics of the oral minoxidil, the absorption is rapid and almost complete absorption with peak serum levels in about an hour. The distribution is a low protein binding, so widely distributed with a volume of distribution 2 to 3 liter per kg. Metabolism primarily metabolized in liver to a minoxidil O glucuronide with only about 10% excreted unchanged in urine. Half-life approximately 4.2 hours. Special population. So the active metabolite may accumulate in patient with renal impairment. So patient with renal impairment, pregnancy, children, and with the heart disorders, please be careful. Drug interaction. It is often used for hair loss at low dose therapy starting from 0.25 to 5 milligram. It is particularly approved, FDA approved only for hypertension at a higher doses. So as in trichology, we use low dose minoxidil as an off-label use. So patient can take oral minoxidil in a fed or a fasting stage. Food does not impact the bioavailability of oral minoxidil. Next slide, please. So indications we all know in dermatology we give for the alopecias. It could be androgenetic alopecia, both male and female pattern hair loss, and other disorders like alopecia areata, chronic telogen effluvium, and other immune-related conditions like lichen planopilaris, etc. Next slide, please. Yeah. So coming to the dosage of oral minoxidil. In the male, It should be in both in males and females. It should be started as a low dose. For male, we can initiate with 1.25 milligram per day, and if required, dose can be escalated by 1.25 milligram every 3 months, up to a maximum of 5 milligram per day. So start with a low dose 1.25 milligram per day. Wait for 3 months. If the patient is not appreciating much result, definitely you can escalate. Or if patient is having a good result, then continue. And initially, after taking the minoxidil, you might experience some hair loss for up to 1 or 2 months, but continue, counsel the patient, and continue up to 3 to 6 months to see a visible change. And moving to the dosage in female, it can be initiated with 0.625 milligram per day. Again, if needed, dose can be escalated in every 3 months, maximum up to a dose of 2.5 milligram per day. After initiation of low-dose minoxidil, visible hair growth may seen after 3 months. The same thing happens with topical minoxidil also. So if there is no satisfactory response after 3 months, consider the upscaling of the medicine. Next slide, please. Yeah. Now we'll go to some clinical evidence-based slides. So in these slides, you can see the low-dose minoxidil for alopecia and the efficacy and safety of oral minoxidil. So there will be a number of slides and studies regarding the minoxidil therapy. Next slide, please. Just a second. Yeah. Side effect and contraindications of oral minoxidil. So while giving the medicine, definitely we should counsel the patient regarding the effect and also the side effects. Okay, so the majority complaints with hypertrichosis. This is applicable for both oral as well as topical. Most common side effect is the excess hair growth. It could be in the face or the body. Second thing is a temporary shedding. There is a transient increase in hair loss occurs in the first 2 to 6 weeks as old hairs are pushed out for new growth. The third one is a cardiovascular symptom. So it is rare at low doses, but definitely since it is a potassium channel opener, it might be careful with patients with heart disease and other antihypertensive medicines. And the other side effects includes lightheadedness, fluid retention with ankle swelling, headaches, or a racing heart. Contraindication should be avoided in pregnancy, breastfeeding, those with a history of heart and kidney conditions. Next slide, please. Yeah, monitoring guidelines. Usually, it is not recommended. Monitor only in case of patients taking antihypertensive medicines. Warnings and precautions. Consult a cardiologist before prescribing low-dose oral minoxidil with a history of heart disorders, particularly in the elderly population, and also with the people on antihypertensive medicines. Yeah. So, yeah, thank you again for listening to the low-dose oral minoxidil discussion. Now,
Thank you so much, ma'am. Thank you so much, doctor, for an insightful and informative presentation on this topic of low-dose oral minoxidil. I'm sure this session was extremely very helpful and enriching for everyone attending today. The presentation was explained in a well-detailed manner. So now we will move ahead to the next round, that is the question and answer round. So to begin with, ma'am, I would like to present few commonly asked questions. So these are few common questions that often are asked regarding the oral minoxidil. So I will just present those questions. So the first question is, so ma'am, most of the questions have been covered in your presentation. The first question is, in which type of patient do you prefer oral minoxidil?
yeah, oral minoxidil, either we can directly start with the patients with the grade 4, from grade 4 pattern of androgenetic alopecia, or we can start with patients who was not getting any response with topical minoxidil for around 3 to 6 months. Those who are not happy with this, you can definitely start. Or along with procedures like PRP or GFC as a maintenance, you can start with oral minoxidil.
All right, ma'am. Thank you so much. The next question is the treatment usually initiated with the oral minoxidil or topical one, or it could be done with the combination of both oral and topical?
Yeah, again, answer to this question depends upon the pattern of hair loss. If it is a grade 1 or grade 2 androgenetic alopecia, definitely we can start with an topical minoxidil hair supplements and the vitamin corrections. Okay. If from grade 3 onwards, definitely you can start with both oral minoxidil and topical minoxidil. But you are introducing a new drug to your body. So always start with the topical minoxidil because some patients give complaints of increased heart rate or lightheadedness with the topical minoxidil. So start with topical minoxidil. Wait for a month, let them understand these kind of complications, and then switch to, or then you can parallelly add an oral minoxidil. Or initially, if you add both, you will not be able to understand which one is causing more side effects to the patient.
All right, ma'am. Thank you so much. The next question is, so the way there is an initial shedding in the after the use of topical minoxidil. So is there also the initial shading after the oral minoxidil?
Yes, yes, definitely. The minoxidil, not only the minoxidil, the hair procedures like PRP, GFC, we can expect initial shedding for 2 months before the new cycle happens.
Okay, so ma'am, in continuation of this question, we have a question in our chat box that so if there is an initial shedding, then how do you counsel the patients regarding these side effects? Because the patient might get he might get a fear of that he will lose more of his hair. So what are your views on the patient counseling?
Yeah. First, understand the patient from the patient point of view. Just understand, talk with the patients regarding how many hair strands you are losing. So initially, it will be difficult for the patient to give a proper answer, but you can ask them to collect the hairs in the pillow cover or on the floor or after shower, how many hairs are losing. Okay. Majority of patients, when they start with this minoxidil, oral or topical minoxidil, initially you can just explain just a little bit more hair loss than what you are experiencing will be there for a 2 months, because definitely they'll be fed up with more hair loss. So you have to counsel them properly. This is the initial way of management. So why the shedding happens? Because the new hair cycle is going to start and we can get a healthy. So if patient get to understand that the new hair cycle is going to start, they will not be much panic. So understand from the patient point of view, counsel them properly, but definitely you have to explain them this hypertrichosis of because any other body part can also get involved, and plus the initial shedding phase. Yeah.
All right, ma'am. Thank you so much. It was explained in a very well detailed manner. The next question is how soon the benefits appear after the use of oral minoxidil as compared to the topical one?
Yeah, that again depends upon the patient compliance and all. Some patient responds very well to topical minoxidil. Okay, and in that patients we can maintain after 2 3 months. So if they are getting good response, maintain with the topical one. And some patients are not getting much response with topical minoxidil, then switch to oral minoxidil, but wait for at least 2 or 3 months to see the proper action. Yeah.
Okay, ma'am. Thank you. The next question is there any difference in the quality or the texture of hair growth seen when oral minoxidil is given or as compared to the topical one or any other hair treatments?
Yeah, topical minoxidil, some patients complains of frizzy hair, matted hair, and it can make the scalp dry. So nowadays, the minoxidil comes with an alcohol-free preparation. So oral minoxidil will not cause these kind of side effects, and definitely compared to the topical minoxidil, oral patients on oral minoxidil, I have seen the hair is being getting more longer and more thicker. But definitely from a follicle, we can appreciate around 1 or 2 hairs, not more than that, even with oral or topical. But I have seen patients with a longer and thicker hair.
Okay, thank you so much, ma'am. Next question is, it was already explained in your presentation, but the question is, any precautionary measures that need to be taken before starting the low dose oral minoxidil?
Yeah, precaution measures definitely you have to take with the patients with heart disease and kidney failure, the kidney not proper kidney function. But again, and if this is a normal population, also counsel them. So that is all actually a precaution measure. Counsel them how it is going to work and what are the initial effect and side effects you can expect, how it is going to act, and how long you have to take. So the main question which majority of the patients is having is about how long do they have to take it. So definitely initially we cannot say that you have to take it lifelong. So if the patients are getting good results, definitely you can taper, and to a maintenance dose you have to keep. So that also in the initial phase you have to explain.
Okay, thank you so much, ma'am. So the next question is, what is the ideal duration for prescribing the low dose oral minoxidil, and how do you decide that when it need to be continued or when the therapy needs to be stopped?
Actually, there is a no such clear-cut data of how long you can continue the oral minoxidil. As long as the patient is start to get started to noticing the results, you can maintain it. Plus, again, you can add procedures like PRP or GFC when you want to taper it, because some or the other support will be there. Okay, should be there. And if the patient is on other vitamin deficiency, correct it, especially the vitamin D and other thyroid factors. You have to ask them to correct. And next thing is, if patient is getting good results with oral minoxidil, after for around 1 or 2 years, you can taper it. You can change, either you can reduce the dose or you can change to alternate day, like that. And it's ideal to be patient on a maintenance dose, provided patient is not getting other complaints like hypertrichosis, lightheadedness, etc.
Okay, all right, ma'am. Thank you so much.
Yeah.
Yes. So, ma'am, these were few commonly asked questions. Now we will move ahead with the questions that we have received in our chat box. Ma'am, the first question is, what are your views on the combination of oral minoxidil with the other combination like other ingredients along or the other therapies such as PRP, the anti-androgens or hair transplantation?
Even, yeah, you can combine other procedures like PRP, GFC if the patient wants to sustain the hair growth for a particular period of time. Definitely, we can combine. Even with the transplanted hairs, we have seen like after years, the transplanted hair also we can see the thinning of hair. So you can maintain with the oral or a topical minoxidil, even if it is a transplanted hair also.
Okay, ma'am. Thank you so much. So the next question is, what if a patient suddenly stop taking the oral minoxidil?
If the patient suddenly, yeah, that counseling also you have to give in the initial phase. If the patient suddenly stops the oral minoxidil, as we can see, it increases the blood flow and the mechanism of action we have seen. So definitely another 1 or 2 months hair shedding will start. So always, if the patient is on minoxidil, always ask the patients not to stop it abruptly. You can taper it. You can add topical minoxidil if patient was only on oral minoxidil. If they want to taper, then definitely add procedures plus topical minoxidil and taper it. No abrupt stopping.
Okay, thank you, ma'am. So there is one more question that we have received. So it's a case-based question. So if a patient who does not show any significant improvement after the 6 months of oral minoxidil, then how do you decide whether to escalate the dose or to change the therapy?
If the patient is not, say, sometimes the patients are more tricky. So you need to have an evidence, okay? So we cannot always depend upon the patient-based data. So in the initial consultation itself, it is better to keep a photograph of the patient, because then only you will able to understand if the patient is getting adequate results or not, because they have been watching their scalp every day. So they might not be able to appreciate it. And the density of the hair, and we all know we cannot increase to to the maximum or fuller thickness. Okay, so definitely sometimes it is up to the patient, they are not able to understand or appreciate the hair growth. So in that scenario, if you have a photograph of the patients in the initial consultation, it will help in the 6 months. So you can compare it and you can count the follicles, and if you see it is not much improvement is there, then definitely you can escalate.
So similarly, we also have another question. So, how would you approach a patient who develop a facial hypertrichosis within the 2 months of starting of low dose oral minoxidil, but it is also showing a good excellent result in scalp?
Yeah, minoxidil shows excellent results in cat, but it is less likely to develop within 2 months the hypertrichosis. That is a one scenario. Less likely prolonged minoxidil therapy can cause the hypertrichosis. So in that case, you have to counsel the patient. See, because of the mechanism of action of the medicine, you can see the other hair is also getting thicker. So one way you can give laser hair removal, and second thing, if it is a female, always check. For the females, it is always ideal to check the polycystic ovarian syndrome or metabolic syndrome kind of thing, and if they are getting cycles regularly or not. In that way, get a gynecology opinion also if we don't know if this or that is causing the hypertrichosis. But definitely for hypertrichosis and the patient is getting good results of the scalp, better to do with laser hair removal for the face, because anyway will be happy with the results on the scalp.
All right, ma'am. Thank you so much. Thank you so much, ma'am. Every questions were explained in a very well detailed manner. So we are almost to the end of the session. So, ma'am, before we conclude, we would request you to kindly share any of your interesting case study in short or any clinical experience regarding oral minoxidil without disclosing the patient information.
Yeah, I get a plenty of IT patients. Okay, so the majority will be having this. So they started working from their 20 to 20s, around 22 or 24, and we know the level of stress in the IT field. So those who are with family history of this, sorry, those who has the family history of androgenetic alopecia, plus the stress and the work, plus their bad food habits, they'll be dependent upon the fast food. And also among those patients, I have seen the regression of the hair. There is a hairline going to improve it like around 3 or 4 months when we can see a great change in the androgenetic alopecia. So those kind of patients you can definitely give lifestyle modifications of food intake, how to take a proper balanced diet, hydration, do exercise, and make them understand what is happening in their scalp, which is because of the genetics and the androgen. Those two factors are strong, we cannot reverse. So what we can do is you have to explain these oral preparations plus topical preparations plus procedure, and if they want hair in the already lost areas, then definitely you can counsel for the hair transplantation. So in my experience, those patients who was on track with a proper balanced diet, hydration, and the vitamin correction. Vitamin D correction is important. Plus, cyclical therapy initially you can give to restore the nutritional balance in your body. So these patients only with topical minoxidil, I have seen improvements along with, because those on their 20s. Okay, coming to their 30, patients with 30s on this androgenetic alopecia, I have not seen much results with only topical minoxidil preparation. In them, you can advise procedures plus oral. But I have seen in their 20s, they get good results with the topical and oral compared to their 30s. Maybe because of their genetics or something. And moving on to the 40s, it is always better to do transplantation along with maintenance with the topical and oral.
Okay. Thank you so much, doctor, for sharing your valuable clinical experience and this practical insight with all of us. Thank you. So, ma'am, we have received one last question in our chat box that what are your views on the oral minoxidil if it is given to special populations such as elderly or children's during lactation or during pregnancy?
Yeah. As we don't have much data on the pregnancy, lactation, and the children, it is better not to start. Okay, and in the elderly population, check on do their blood routines and check on what all other medicines they are on. And in the elderly population, once they cross their 50s or 60s, they will not be happy with the oral or a topical minoxidil. The action is less compared to people on their 20s or the 30s. So better in them, they can directly do a transplant and they can maintain with a topical or an oral.
Okay, thank you so much, ma'am. So, would you like to share one clinical advice to all your colleagues who are attending this session that will be helpful for them in their daily clinical practice?
Yeah, daily clinical practice. If you are coming across a case of alopecia, it could be androgenetic alopecia or telogen effluvium or traction alopecia. Better understand what kind of the food habits or the lifestyle of the patient, how they are going through, how they are taking the seed, and educate them about this pattern of the alopecia. And don't always jump into a minoxidil. You always have a minoxidil-free preparation. Initially, we can start with them that for the grade 1 androgenetic alopecia or a other kind of alopecia. Then, if you are not seeing much results, definitely you can start with minoxidil because nowadays people are aware about the minoxidil because it is easy to get this as a over-the-counter drugs. It has become OTC. So many of them will be already Googling it about the effects and side effects of minoxidil. So before starting minoxidil, you can try the minoxidil-free preparation. And then if you are not able to see result, definitely you can start minoxidil-based preparations.
All right, doctor. Thank you so much for such an thoughtful and amazing
Yeah,
advice for all your fellow colleagues.
yeah,
Thank you so much, doctor. So, as we came to an end of today's webinar, I would sincerely like to thank you, Dr. Farzana, for such an excellent and enlightening session on low-dose oral minoxidil.
yes.
Also, I would like to extend my gratitude to all our guest doctors and participants for their active participation and engagement throughout the
Hmm.
session.
Yeah, thank you
We
so much.
truly hope, thank you so much, doctor. We truly hope that this webinar was informative and beneficial
Yeah,
for all your clinical practices.
yeah. Thank you,
Thank
Minno
you.
Strong, for this wonderful session. Thank you so much.
Thank you
Yeah,
so much, doctor.
take
Have a
care.
wonderful
Yeah.
evening ahead, everyone. Thank you. Navya, we can